Hi there, and welcome back to Dr. Carri's Clinical Corner. I wanted to get this video out before the end of April because April is C-section Awareness Month, and so I wanted to talk about C-section and why you might need pelvic floor therapy. So, a couple things. As pelvic floor therapists, we're kind of trained in all things pregnancy and postpartum, so you might not need to work on the pelvic floor muscles themselves, but you might. So, I tell people just going through a pregnancy might be enough to make you need pelvic floor therapy, like the pelvic floor muscles themselves, even if you had a baby C-section. And oftentimes, my moms, they go into labor and they try for a vaginal birth, but something happens and they need a C-section. So sometimes they kind of have both things happening. So that also might mean that they need pelvic floor of the pelvic floor muscles rehab, specifically like bladder issues, pelvic pain, prolapse, things like that. So it can happen even with a C-section. But I want to talk about some things more specifically towards C-section and what I help moms with in the clinic. So first of all, we work on the scar a lot. So I'm kind of obsessed with scars because sometimes it's like a little bit of rehab and manual therapy and like attention to the scar can make such a big difference in other things, because the scar, what happens is normally our tissues, we have skin, we have connective tissue, we have fat, muscle, blah, 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 all these things. They're nice and layered and organized, but when we cut through something, we make a scar. So sometimes down below, it gets kind of like gibbly gobbly and it's not well like organized. And so by doing scar massage, by working on the scar itself, it can help that form better and not be like pulled under. Like I kind of think of like roots under it that are just like all grown deep in there, but really we want things to be like nice and laid out, and so then the layers can move on each other in all the directions. So I really like to work on the scar itself. So I'll link some videos to some other videos I've created of like how to work on the scar and some exercises. But yeah, I like really move the scar. So once it's healed, so after your stitches, staples, the glue, whatever, and then usually you have what's called steri strips. They're like the little white tape on it. When those fall off, then everything's healed, and then we can like start gently working on it. But we want to make sure the incision is fully closed before we start working on it. But I like to move it around, massage around it, different things. And then this is called a silicone strip, and I'm not gonna like use this, but basically this can go right above your scar, and it's silicone, and it does a couple things. It helps protect the scar. So a lot of my moms like it because the feeling of like their underwear or their pants rubbing over the scar feels really uncomfortable. So this kind of gives them a protective layer. And then also, in theory, this sort of helps lift the scar from the tissues below it, so it can help it heal and not like be all dented in. So sometimes they call it like a C-section shelf, where sort of like the tissue comes in and then you have kind of like this bulgy tummy above it. And that's what we're trying to avoid. And so by working on the scar by hand, that can help. By the silicone strips, that can help. So that's a couple things that you can do. And then let's talk about exercise. So a lot of moms come to me and they're like, I'm scared. I don't know what to do. What's safe, what's not safe. Like I just had abdominal surgery. So that's a lot of what I work on with my moms, is getting them moving and feeling comfortable moving and creating an exercise program to strengthen their abs. And so I start with some really gentle movements like cat-cow, thread the needle, like lower trunk rotation, some general like chunk movement, mobility, stretching. And then I'll start with some really basic like abdominal strengthening exercises. So that's kind of how I start in the clinic with them. And then we'll also work on whatever else comes up. But it's really good to have a plan of how to work on your scar, how to get your body moving, and how to strengthen your core after having a C-section. So all those things are things that I work on in the clinic with my clients. And then if you want more information, I have a free ebook download on C-section recovery. And then I also have an online course that is 4 weeks, and it takes you through all the things I talked about. Like it talks a lot about anatomy and healing. And then in the 4 weeks, we talk about how to work on your scar in your abdomen, like massaging it, how to get your trunk moving, how to like strengthen your abdominals, and then how to incorporate that into a whole body workout. So that's a 4-week online course that you can sign up for also, and I will link all of these things below. And yeah, there's help for you, you know, oftentimes just getting started and having that foundation. I tell all my new moms, like, once you have a foundation and you're, you know, have a place to start that's safe, then you can go and build on that. But sometimes those early days, it's sort of like, I don't know what to do, or things like don't feel right and I don't know what's safe. And so either look on my other videos, download my online course, or come see me or another pelvic floor therapist, either virtually or in person. So there's help for you, my C-section mamas.